This tutorial will cover an exam run-through from start to finish on the iPad. Following this tutorial, you will be able to document a visit for a refractive diagnosis. The technician will take the patient back for pre-testing, review their medical history, and mark the clipboard reviewed. Here we show the clipboard was reviewed today. If any changes are needed to any section in the clipboard, go ahead into that section and make those changes. So let's say the patient is experiencing seasonal allergies and today they're taking Claritin for that. So we're going to go to medications. First we're going to unmark as reviewed and we'll add in that medication of Claritin. Once the medication's entered, we would not want to mark as reviewed again because if you remember, when we selected marked as reviewed, it showed the reviewed date and no changes noted. So we did make a change, so we don't want to mark it reviewed again. I'm going to go to allergies. So again, here it shows reviewed on, no changes noted. We're going to unmark as reviewed. And in the other box, I'm going to type in here, seasonal allergies. And again, I would not want to mark reviewed again. We'll just save this information and we'll go back to the patient chart. So here we are now seeing the changes under the medications and the allergies. We're not seeing the reviewed date because we did go in and make changes. So next we're going to create a new visit. We'll update the Manage Visit Setting information. And let's go document our chief complaint. So the patient is complaining of blurred vision. It's in both eyes. And we'll say it's at distance, having some trouble with their glasses. It's mild. It's been going on for about 3 months. And both eyes are equally blurry, and we'll save that. We'll then go to Review of Systems. This is an established patient, so we'll mark Custom Reviewed. And we'll say they're having poor vision today, and we'll save that. We're next going to go to the vision exam. The patient came in today wearing glasses that we gave them last visit, so we'll go in here and we'll go to View Import Refraction History and pull that final RX in from the last visit. And we'll go over to Visual Acuity and we'll document those corrected visual acuities today. This patient also is a contact lens wearer. They brought those with them today, so we're going to go up to View and Import. We'll pull in that final RX from the last visit and save that information. We'll then document our auto refraction. And I'll go down and document the pressure information. And we'll save that. And we'll go back to the overview. So here we've documented our chief complaint information as well as the vision exam for the pretest. So at this point, the technician would then log out and the doctor will log in and come back and see the patient. From the notes view on the home screen, I'm going to go into that patient's visit. And next I need to review all the information that was documented. First thing, doctors, it's really important under visit settings, review the bill as, make sure that we have that set properly. Are they new or established? And then under attendees, make sure that it's showing your name first and your staff member listed second. It's always important that doctor's name be listed first. You can review the clipboard detail right here under the medical history tile by selecting View. Here you can scroll up and down to review the clipboard details, and if you need to go in and add information, you can edit from here and document. You can review the vision exam details that your technician entered in by touching the bottom right-hand corner. That'll open into a full screen view. You can scroll in and take a look at all of the different information. And then we want to go into the vision exam. And the first thing we want to do here is mark those pupils' visual field and motility as normal. We can then go to the refractions and document our manifest refraction. So we could choose the view import, and maybe we want to pull in the wearing from today and then just make any modifications here as needed. We can also use the clear button here to clear out those visual acuities that we imported in, and then we can set the visual acuity for today. And we'll save. And maybe this is going to be our final prescription for today, and we want to create an RX for this patient. So we'll select the Add Final RX and save that information. I'll next go to contacts, and we're going to add a contact lens prescription in here for the patient. Again, they really like the contacts that they currently are wearing. So we're going to choose the view import. We'll import that wearing contact lens in, and we'll just modify the prescription here. We can document visual acuity, assessment, and save that information. And we can create a final RX right here. I do plan on dilating the patient today, so I'm going to go into dilation and document those dilation drops. And now I'm going to go into the exam and start documenting my exam. So we'll perform an exam, we'll choose an eye exam, we'll go to the discs and document the patient's CD ratios, and we're done. And we're going to document myopia. We're going to say that it is an existing diagnosis and it's worsening and it's in both eyes. We talked to the patient about the myopia, so we're going to counsel them. We did write a prescription for the patient for both glasses and contacts. We're going to bill for a refraction. And we want to see that patient return to the practice in 1 year for their annual eye health exam. We're going to save the visit note. All the areas that were documented are filled in and can be reviewed. If I need to make any corrections, I just simply go back to that section and update. Under the billing, we see the 92014 and the 92015 along with our diagnosis. I could override the billing here if necessary. If I'm not quite ready to finalize the visit, I can send the RXs and send the charges, and that will send them over to the practice management. When you're finalizing, those will automatically go for you, so we'll go ahead and choose to finalize our visit and then finalize the note. Thank you for listening. We hope you found this tutorial useful. Please visit our support community to view additional tutorials.